My name is Troy Wall, and today we're going to be doing medication administration. We're going to be doing pill form, and we're also going to be doing injection. The first thing I want to do is I want to introduce myself to the patient. Hello, my name is Troy. I'm going to be a nurse. We're going to be administering some medication. You want to use two patient identifiers. You ask for the name and date of birth, and you can also check the bracelet. What you want to do is checking the MAR. You want to make sure that you have the correct medication. You're going to do this 3 times. First when you're taking the medication out, second after it's taken out, and third right before you give it to the patient. You want to use the 6 patient identifiers of right patient, right medication, right dosage, right route, right documentation. After that, you have the oral form, which would be the pills. Some can be crushed, some cannot. Ones that can be crushed, you can add to, such as an applesauce or a pudding. The ones that cannot be crushed must be taken orally with either water or juice, depending on the medication interactions. If the tablet is scored, it may be used with a pill cutter and administered that way. Next, we're going to go on to the intradermal. For everything, you want to take an alcohol swab, and you want to clean the site. You want to allow that to dry for about 20 seconds, and once it's dry, you're good to go. So using your needle, you want to uncap it. For this one, say we want to do 10 units, we will withdraw 10 units of air, placing into the vial. You want to inject the 10 of air, and then withdraw 10 of the medication. Making sure that there's no air bubbles. For this one here, with the bevel up, you want to pull the skin taut, and you want to go in at about a 15-degree angle, just under the skin, and you want to inject so that you get the nice bubble under the skin. Making sure not to recap, you would discard the needle into the appropriate location. Next is intramuscular. This is a little bit larger. What you want to do is the same technique. Is you want to withdraw. Say for this one we wanted 2 milliliters. You would withdraw 2 milliliters of air. Insert into the vial. You would expel the 2 milliliters of air, and then withdraw, making sure not to get any air bubbles. The 2 milliliters. Again, making sure that there's no air bubbles. For this one here, again, we would clean the site. For this one here, you want to actually push up on the skin. You want to insert straight in, withdraw, relax, and straight out. Again, discard of in the correct location. For the next, we have the subcutaneous or insulin. For this one here, we're going to do the clear first, and then cloudy. A good way to remember it is the R is for the clear, and we want to become RN. So the same technique goes, except this one we're going to do it a little differently. What we're going to do is inject the air into the cloudy first. So we'll do 10 units of each. So I want to withdraw 10 of air, insert into the vial, and I want to put 10 into the cloudy. Next I'm going to grab the clear, since that's the first one I'm going to be administering, I want 10 units of air. Insert into the vial. Be careful not to bend the needle. Insert 10 of air. Now while I have this out, I'm going to withdraw the 10 of the clear, making sure that there's no air. At this point here, if you're a little bit off and you do have air, you can expel it since the medication is not yet mixed. So I'm a little over 10, so I'm going to go to 10. Now I would do the cloudy. Once the cloudy is withdrawn, you cannot redo it. If you go over or under, you need to start over again. So at my 10 units, I'm going to insert. I'm being careful not to get any air. I'm going to add 10 units, which brings me to 20. Withdraw. At this point here, it's going to be the same as the intramuscular. You're going to clean the site, wait 20 seconds, and again, going taut, straight in, inject, relax, and straight out. Again, you would not recap, you would dispose of in the correct location. And next we have the ampule. So with this one here, we take the ampule first. You want to make sure that the medication is out. You can move it, and once it is completely out, you're good to go. Using an alcohol swipe, I'll wipe around the edge, and using a gauze going against me, as to be careful not to break glass towards the face. I'm going to pull away from me and pop it. That would be disguised of in the sharps container. Now, using a syringe with a filtered needle, at this point, you're going to insert the needle and slowly turn. You're going to withdraw all the medication. Being careful to move the needle down as you go. And be careful to keep the needle in the vial the whole time, as to not break the seal and get all the medication.
Yeah, towards you, so the stuff goes away. You did it.
Towards me, but away. I
Which
broke
way
it
did-
this way.
You broke
Towards
it
me.
away.
No, towards me, like this way. I don't know.
Show me, just show me.
Because I was having a hard time with it, so I was pulling this way, that way, no, this way, like this. So I was supposed to do that way?
Right, the top, your
At this
top.
point here, the glass would be discarded into the sharps container.
No, I know, but.
I would remove
But right, they say.
any air.
Where it's coming here. That's why they say hold the top.
I would have this over the trash can.
I don't care.
Once the air is gone, I will remove the filter needle, and I will replace with the regular needle. At this point, uncap it. Again, making sure there's no air in it, and it's going to be done the same as all the other ones. To push up on the skin, you want to insert it at a 90-degree angle, straight in. You want to expel the medication into the skin, relax, and withdraw. And again, this would be put in the appropriate location. And that's how we do the med administration.